If you've recently had a hip replacement or you're about to have a hip replacement, you may be wondering, how do I get in and out of my bed safely and not end up breaking any kind of hip precautions that I may have? How do we do that safely? In this video, I'm going to show you 3 ways how to get in and out of the bed after hip replacement safely. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! Now, before I even show you those ways on how to get in and out safely, we need to first talk about the hip safety. You probably have some hip precautions depending on the kind of surgery that your surgeon did on your hip. You may have posterior hip precautions, which is usually the case if you have your incision that comes on the back a little bit. Those are going to be different from an anterior hip precaution, which usually the cut is a little bit on the front and maybe on the side a little bit. They also have surgeries that go directly on the side. It's going to depend on your surgeon and his or her preference and the precautions that he or she has given you. Generally speaking, a posterior hip precaution is going to include the following. You're not going to be able to bend past 90 degrees, your hip, okay? So from your thigh to your trunk, that's supposed to be 90 degrees or less, okay? If you're going to go to put on your socks or lean forward, you broke those hip precautions. That's an issue because it can actually cause a dislocation in the back. The ball can just come right out, okay? So we want to avoid bending over or bringing your knee up real high. That's very important to know before you try to get in and out of the bed, especially if someone's going to be trying to help you. You got to know your hip precautions. So don't bend past 90 degrees. The other thing you want to never do when you have a posterior approach on the hip is don't cross your legs. Do not cross your legs, because if you cross your legs, that ball can come out of the socket. Okay, so do not cross your legs. Don't bend past 90 degrees. Don't cross your legs, and don't point your feet in. Okay, keep those ski tips pointing forward. All right, if you've ever been skiing, keep those ski tips up. Don't let your feet turn in, because that's going to put on that ball, it's going to come backwards and it could dislocate. So those are the 3. What about an anterior approach? Now, for anterior hip precautions, there's 3 things you want to avoid as well. The first is you don't want to bring your leg backwards behind you, so you don't want to end up kicking a person in the line behind you. That's not going to go well for the person or for your hip, okay? So don't do that. You don't want to cross your legs, and your feet, we don't want to have your feet turning out. Again, we want to keep your ski tips pointing forward. Now, whether you have posterior hip precautions or anterior hip precautions or other precautions, like sometimes surgeons want you to maintain a pillow between your knees, like when you're laying in the bed. And sometimes a surgeon doesn't want you to bring your leg past neutral. They don't want you sliding your leg way over here, especially if you've had a side approach, a lateral approach. But either way, you got to know your kind of precautions and your kind of surgery before you try to get in and out of the bed, because if you don't, you could end up placing your hip at risk of a dislocation. Very important to know these things before you get in and out of the bed. Now let me show you some of those ways on how to get in and out of the bed safely. Now, each of these 3 ways, we're going to need to make sure we keep our hip in that neutral zone so that we don't break any kind of hip precautions. The first way, we're going to have someone help us. The second way and the third way, I'm going to show you how you can do it on your own independently, because that's what we're all about. We're about independence, keeping ourselves independent. So the first way, we're just going to have someone help us guide that leg into the bed. When you sit down, you're going to sit down right here. And if you have someone to help you, thankfully I have my wife to help me. But just a little side note, she is pregnant, yay. So we're going to have to be, she's not going to be able to help me too much because she's pregnant, but you'll get the concept here. So you want to have someone try to kind of guide you along the way, and you're just going to try to scoot your bottom back first, and you're going to kind of slide yourself up there. Now, again, she's going to need to make sure she doesn't bring this leg way up and over, okay, when I'm not ready. She's going to try to match the leg with what I'm doing with my hips, all right? She's going to keep everything in line. So I'm going to back on up, and I'm going to just kick my leg out, and she can kind of guide it. So she can hold my leg down there, and then I'm going to help just kind of bring this. And so she's guiding me along the way. Now, she's not lifting me up. Look, I'm not breaking those 90-degree hip precautions. By the way, nice body mechanics. We're going to go like this, and she's just going to help me like this. Okay, that's good. Thank you, Lauren. And then from here, I can just bring this guy up, and then I've got this guy and slide him over, okay? So the whole time, I didn't break those 90 degrees, that precaution. I didn't swing my leg way out, and she was only guiding based off of what my hips were doing. She's watching my hips. She's bringing everything what the person's doing. Let the person who's helping you be the lead. Don't have someone just bringing your hip over and your leg. That's not going to be helpful. You need someone to work together as a partner, and they need to go along with what you're able to do. So that's the first way. Now let's do the second way and the third way, which is going to be all about you doing it on your own independently. Now, while having someone can be helpful, it's not always the most beneficial because that person doesn't necessarily know your hip precautions perfectly, and they don't know how your body is feeling, and you guys have to work together as a team perfectly so that you don't end up hurting your hip. And if they're doing it, you're not going to be able to get stronger faster. So you know your own body. They don't know your own body. It's best if you can do it on your own. So that's what this next way is going to show you how to do that. We're going to use our hands and our arms in the bed. So I've got my right hip replacement. I'm going to make sure I don't break those precautions while doing this. We're going to sit down on the bed, and you're going to try to sit back as far as you can. We need to remember that our leg is attached to our bottom. So the more our bottom goes back and in to the bed towards the pillows, the more our leg will be captured and brought up and held by the bed, and you don't have to work so hard to try to get that hip up and in there. So what are we going to do? We're going to lean back, okay, so we're not, basically leaning forward because that's going to break those precautions. We're just going to come back like this. We're going to kind of butt walk a little bit. We're going to butt walk, okay? You can see my leg is coming onto the bed, and then once your thigh or your calf is a little bit on the bed, then you can start to work your way over this way. When you've come back a little bit, and then you just kind of do one of these guys, see? Look at that. All I'm doing is sliding my bottom. Because I'm sliding my bottom, the bed is doing the work. I don't have to, I'm keeping my pelvis and my leg in line. I'm not breaking that hip precaution. I'm not turning my feet in or out or anything like that. And I can come like this, and I'm going to go like this. And then from here, I can just get my heel up and over a little bit. And then from here, I'm going to plant my other leg here, and that's going to help me drive this leg down into the bed and slide this one over. You can either do it with your leg, or you can bring it over, or you can bring it over like this, okay? Again, I'm keeping that hip and the leg in line, that pelvis in line, no problems. So I'm going to come around like this, okay? And that's how you get in the bed. How do you get out? You do a very similar thing. You kind of come up on your elbows a little bit, okay? You're going to bring this leg over, and then you're going to help with this one. Keep those feet pointing up, okay? Keep that foot pointing up, okay? And then from here, you just come over like this. And then from here, all I'm doing is I'm pushing myself forward. I'm just going to bring my bottom forward, and I'm going to make sure my foot is pointing up. I'm going to come on up like this, and there I go. That's how you can get in and out of the bed with just your arms and using the bed. Now, what about instruments or tools? What about those guys? Now, they do make some tools to help you get in and out of the bed a little bit easier if you've had a knee replacement or a hip replacement, or if your leg's just hurting, either way. But you do have to be very careful with these because of those hip precautions. This is a leg lifter. I'll put a link in the description below. You have a leg lifter, which has a spot where you put your foot in, okay? And it loops around your foot, and you can hold on to this guy and help bring it up. I'll show you in a moment. We also have this guy, okay, kind of looks like a dog, you know, capture, or maybe a leopard capture. Okay, sorry, Whiskey. But anyways, we've got this guy, and this guy has a little loop down here, and it can go around your foot as well, and it's solid. It can bring up and over. And if you don't have any of those guys, you can always try to use a blanket or a sheet. You can just wrap it around and use that and help you. So let me show you all these little guys in action. I'll show you the leg lifter, my favorite, and then I'll show you the other guys. The leg lifter. You're going to bring it down, and you're going to you're sitting on the side of the bed, not breaking those precautions, and you just loop it around your foot, okay? Now, you don't want to lift up like this. Okay, you just broke your precaution. That's a problem. And you don't want to just swing it out, okay? That's not going to be helpful, okay? So, again, you want to try to use this, guys, a little bit of a help, but you still want to do like we taught you in step 2, the second way. We try to get your bottom back as far as we can, and then once we need that little extra help, you can use something like this to kind of help you up and over that little lip. So we're going to scoot back as much as we can, okay? And from here, you can try to use this and keep scooting. I find what helps me and what I teach my patients is I try to still help them move back as much as they can, okay? And once they get to that point where they feel like they can't get up there anymore, I say, okay, use your little guy, loop it around, okay? Right there. And then from here, you lean this way a little bit and you just kind of bring it up a little bit. Not a whole lot, okay? Because that's going to be breaking those precautions on some, and it's just not going to feel very good, but a little bit. So we're keeping that pelvis in line. Then from here, I just always plant this leg, okay? And I can use this guy up and over a little bit. Just a little bit of a help. Same thing, getting out, you can always loop it around the foot, okay? Loop it around the foot, and you're going to bring your other leg over a little bit. Keep your pelvis together and your legs together as much as you can, okay? And then from there, you just kind of slide on forward. So that's the leg lifter. You also have this guy, same concept. You loop it around, you come onto the edge, you can kind of bring him up, you know, bring it up and over, okay? Just another way. And if you don't have those guys, you can always use a sheet. The sheet works just fine, or a little blanket. You just go down there, or again, you try to work your bottom back first a little bit, okay? From there, you lasso. You try to lasso. Let's see. Look at that. All right, made it. So from there, you're just gonna lean back and you're just gonna bring it up and over a little bit just to get it on the bed. Let the bed do the work. You don't need to do more work. You don't need to try to bring your hip over. That's too much. So once it's there, you plant your foot here and then you just kind of bring it up and over, okay? So getting out, same thing. You bring this guy over, you bring him a little bit, little by little, you inch it over, okay? And then from there, you just bring it off, and there you go. So whether you use a leg lifter, which I'll put a link in the description below, or a sheet, or the other guy, that's another way for you to do it so you maintain your independence and you recover faster. The key with using these guys though is just make sure you're not breaking those hip precautions, because just like if someone else is helping you, if you decide and roll like you're trying to catch a fish or something, that's not going to be good. You're going to catch a trip to the hospital. We don't want that. So just be careful with those guys. So those are 3 ways on how to get in and out of the bed a little bit easier after a hip replacement and not end up breaking those hip precautions if you have them or having a fall. Speaking of falls, if you want more tips and training on how I teach people to prevent falls, you can find that in the link in the description below. And I'd love to hear from you. Have you had a hip replacement? If so, what have you done to get in and out of the bed a little bit easier? Could you comment down below? That would be super helpful for all of us. And don't forget, if you want more videos just like this one to help you learn how to move better and stay independent to enjoy your life, click the subscribe button down below, and we'll see you in the next video.